head of the Secretariat of the UN NCD Task Force and the Health for Life Fund. And we have not scripted a 10 to 15 minute conversation between the two of you to inspire us. And I was very much inspired by your remarks yesterday in the plenary. Let me bring a microphone.
Thank you. Good afternoon.
Well, good afternoon and welcome, and thank you very much for being here today. If any of you don't know about the Honourable Christopher Tufton, who's the Minister of Health and Wellness, he used to be the Minister of Industry, the Minister for Industry, Investment and Commerce, and Minister of Agriculture and Fisheries. And I'm going to come back to that a little bit later, because that's no accident that I've said that. And you could probably guess exactly why it's important at the moment. But let's go back to some of the big picture issues. Now I had 4 political declarations. 2011, then there was the 14 high-level meeting, 18, and now this. What do you think? What's the big picture? Where do you see the challenges? Where do you see the successes? Are you happy with what's come out?
Well, first of all, thank you for the opportunity, and thanks to all who are here. I think the conversation has to continue, and from that perspective, it's a good thing. We have to ensure that we educate, that we inform, that we persuade, that we influence, and coming together under the UN umbrella or in the regions of the world under the different umbrella representing the WHA is good, because it helps countries that are strong, helps those that are not so strong, provides best cases. Case studies are very important. And so from that perspective, I think it's good. The data, however, is suggesting that while we have made some progress on areas like tobacco control, we still have a far way to go in terms of premature deaths as a result of NCDs. I'm told only about 19 or so of the less than 200 countries are likely to meet the targets that have been set, and Jamaica being one of them that will have to redouble its efforts. So while we can identify progress, it's a work in progress. I think that's the best way to describe it.
So you rightly point to the issue of premature mortality, but what also a number of countries are facing at the moment is an aging population, and we're going to see healthcare needs increase year on year for these populations.
Absolutely. The challenge of where we go from here is a function of our demographic profile, and the aging population is a big challenge. In some instances, maybe because we're making progress in preserving life longer, even though we also have the challenges of premature mortality. It is going to require a rethink around how we deal with primary care in the first instance, tackling the challenge within the communities where people live, even before they get to the hospital. Countries vary in terms of their preparedness and their infrastructure as it relates to primary care. But those who have will also have to look at how they tap into technology. It's going to be a big issue. Home monitoring, self-monitoring, access to drugs to stabilize particular sick profiles. So the demographic profile, the shift in longer life is also going to require a different response to dealing with that population, while still encouraging, of course, the youthful to remain healthy and nudging them into health-seeking behaviors. Because I've always said that the real challenge to NCDs is not just clinical, it's behavioral. And I've been one, as a behavioral scientist, not a clinical scientist, to make a closer link between how people live within their environment, the choices they make, the foods they eat, rest, exercise, and what the risks of NCD may represent for them. And I think we're going to have to redouble our efforts in that regard. And there have been some efforts to do that at the level of the WHO.
So trying to create a healthy environment, and you're absolutely right, children, our future, and it is very demoralizing when children go into school and they get all sorts of lessons learned about pyramids and nutrition, and they go into the corner shop and it's full of sodas and it's full of chocolate and high fat, sugar, salt contents. That makes life really very difficult. And the reason that I was talking about your previous roles is because clearly we all talk about a whole of government and a whole of society response. Very easy words. How on earth do you navigate as a Minister of Health in bringing others to the table and convincing them that health is relevant and important for all of them?
Well, it's not easy because industry has a particular goal. It's a bottom line for them. And marketing, which is my core discipline, and so I used to be on the other side of that spectrum, is to convince loyalty to brands. And that can lead to a range of things if those brands are not healthy. In Jamaica, what we have tried to do is to collaborate at the level of our cabinet. And so the arguments are made there. But there's civil society. Partnership in health is absolutely critical going forward. And to the extent that you can join forces with civil society, it makes a big difference. So for example, I'll give you two quick cases. When we wanted to restrict sugary drinks in schools in Jamaica, we joined forces with Bloomberg Foundation out of New York here, with the Heart Foundation in Jamaica, and we endorsed it as the Ministry of Health. We launched a one-year campaign looking at the ill effects of too much consumption of sugar. But then there was a general sentiment of the population who bought into that. And then we moved behind that with the policy. And we got better reception because children are emotional. Most adults will be thinking positively about how to make their children healthy. But that was a strategy. We didn't do it directly. We went via a civic organization. The other thing that we have done for healthy consumption is the school nutrition policy, which I think is most fundamental in any society. And we have been able to champion that by engaging larger stakeholder participation, speaking to the parents, speaking to the teachers, the principals, the faith-based communities, getting them to appreciate the relationship between what our youngsters consume and how it impacts their learning and their development. There's a reasonable argument to be made, and it's not just logical, it's also emotional. And if I were to use my marketing hat in support of public health or good health practices, it's really an appeal to the emotional that generates more a response. And in a sense, you have to think like industry and apply the same principles. It's not because it is true clinically that people are going to buy into it. You have to make the emotional connection. And we've been able to do that and got the school nutrition policy, I think, introduced. It's now to train and to implement it for consistency. The final point I'll say on that is the reason why I think it's so game-changing is because it's habit forming. The best thing to do is to tackle the problem of healthy diet at the early stages of one's development. A child who grows up drinking water as a standard fluid with his meals, his or her meals, will eventually not require a soda, a sugary drink. It's a learned behavior. And that's really what you want to promote. That's kind of difficult with you and I because we've kind of passed that bridge long ago.
And of course, if you look at the political declaration, not just this one, but previous ones, but the importance of legislative, regulatory, fiscal action is really clearly set out. And so the other group, important group, is legislative bodies and making sure that they're moving forward on this. And they also should be responsive to their own communities, and their communities should be demanding action from them as well.
Yes, and we do that in Jamaica. I mean, we have, for example, we're now moving to comprehensive tobacco legislation, and that we have tried to seek on both sides of the political aisle consensus through a joint select committee. So how you maneuver the parliament, which starts really at the level of policy from the cabinet or the executive arm of government, is to get your colleagues to buy into what you're championing, and you have to provide the evidence so to do. Now, the thing with a cabinet or the executive arm is that each portfolio represents different interests. And so you have to target the ones that represents the interests that you have to overcome in it first. So industry, for example, the Minister of Industry, Investment and Commerce, where I was at some point, he has to meet with his traders and his manufacturers. And they have a particular perspective, which is not always similar to health. And so you have to find a way to create a conversation around that, even before you get to the executive, and then to further take it to the parliament. So we have done that, for example, with trans fats. We have been able to get some consensus around the elimination of trans fats out of our food group. You have that here in the US. We did not have that there, and that's a major cause of cardiovascular related disease. But that started with a conversation, showing the evidence, and then to some extent appealing to the emotions of those who are impacted to create the pressure from below to influence the parliament.
Okay. Now I want to come back to this meeting here, which is around investment cases and South-to-South exchange. And you were at the vanguard of doing an NCD investment case many years ago. And I'm interested to know, and I'm sure the audience is very interested to know, as to how helpful that's been, how it's influenced things, and also how you think a South-to-South platform can support and exchange findings and ideas and discuss some of the challenges and recommendations that come from this.
So firstly, the investment case was very good. It's a bit dated now, so I'd love to update it. It was 2007, 2008, but the numbers do tell a story. And you need data when you make your case for what needs to be done. While the emotional appeal is important, it has to be grounded in the data. And so it allowed us to influence our 10-year strategic plan and to determine how we champion things like alcohol consumption and policy around alcohol consumption or the reduction of, tobacco legislation, primary health care reform at the community level. So there are many very positive things which we can advance in a more data-driven way. If you have to argue with the Ministry of Finance around allocation to health, you have to show them numbers. And the numbers have to make sense. Productivity is a function of healthy people, for example. So the argument has to be driven in a way that the listener can relate to, and that listener is going to be influenced by what their perspective is. So the investment case would make that very important, and we're very happy for that, and would like to continue on that trajectory. Beyond that, it's really how we leverage the information that we have, as I said, to get decisions made. And 5 months ago, I visited when I recognized that as small island developing states like Jamaica are challenged by several things: high import of foods, limited personnel. We lose a lot of our healthcare workers to the US, for example, because they have better opportunities here. So it triggered, in my mind, the need to extend the collaboration beyond the Americas. I ended up in the Philippines and India, where we have signed MOU with those countries to establish joint training of healthcare workers. The Philippines, as you know, is the largest exporter of healthcare workers, nurses in particular. India has a very good reputation for training doctors. And only yesterday I had a side meeting with the Secretary of Health of the Philippines, further advancing for a delegation to fly from the Philippines to Jamaica, half the way around the world. And we are going to be doing joint training using technology in advanced nurses. They'll send faculty to Jamaica, some online, and then we'll do clinical rotation between the two countries. He and I were at a course at Harvard and drum up a good conversation and friendship. And we believe that we can show some leadership in that regard, because one of the largest challenges that we face now in healthcare going into the next 20, 30 years is the human capacity to provide the services, and it is unequally distributed. Smaller countries are more challenged than the larger countries, and Jamaica is a victim of that because we do so well at training our workers. So we are extending our borders beyond the Americas, and as I said, India and the Philippines are good partners for us in that regard.
Okay, well, we're going to have to wrap up in just a moment, but there's one last thing. A South-to-South platform that is being established under the under the Health for Life Fund, which is going to be doing some work on investment case. What guidance and advice would you give those that are setting this up in its early days?
Well, I would start with where the biggest challenges are and where the advantage may reside on one side to support the other. And leverage the platforms that are available to benefit from the distance. I mean, nowhere is far anymore because of technology. And so you can't, well, I shouldn't say you can't, but the efficiency of South-South cooperation will have to be leveraged on the platform of technology and persons' willingness to engage that technology. And I think the receptiveness of the proposal will be greater if that becomes a kind of core requirement. And then beyond that, looking at the areas where the greatest needs are. And I think human resources is perhaps the greatest. And then, of course, to the extent that that very technology can be advanced, not just to support training, but to support service provision, I think that makes a lot of sense too.
Thanks very much. I wish we could have another hour of your time, but sadly we can't.
I understand.
Thank you very much indeed,
Thank you.
Dr. Tufton, for spending time with us.
Thank you
Thanks
very
a
much.
lot.
Thank you.